Hello, I'm Dr. Amanda Sathyaparla. I'm one of the respiratory and sleep consultants here at Harefield.
Hello, my name is Amna Hoda. I'm the Chief Clinical Physiologist in the Respiratory Physiology Department.
The aim of this video is to introduce you to CPAP therapy, continuous positive airway pressure. I'm going to refresh your memory about what obstructive sleep apnea syndrome is and why CPAP is useful. Hopefully you will already have been told this by your clinician in clinic. We're going to run through how to assemble the CPAP device and put the mask on. We're going to show you how to troubleshoot problems with your machine or mask so you become comfortable with the equipment, and show you how to maintain the machine. We're also going to hear from patients about their experience with CPAP, and I'm also going to talk to you about notifying the driving licence authorities, because this is something that patients worry about having to do, so I'll run through the details for you. Obstructive sleep apnea syndrome is the most common sleep-related condition. Apnea is the medical word for pausing breathing. So this is a condition where you pause breathing during sleep because of an obstruction or blockage. And that blockage is happening in the throat because the muscles in the throat are relaxing and blocking off the airway. This results in the sleep being broken and fragmented and therefore not good quality. And that can result in you feeling unrefreshed when you wake up, waking up with a headache and feeling sleepy during the day, or feeling that your mood, memory and concentration aren't as good as they can be. CPAP is a very well-established treatment, and it's an excellent way to treat the symptoms of sleep apnea. The way that it works is it prevents a blockage in the throat by dispensing air through a mask into the throat, keeping the airway open throughout the night.
My name is Carol Ann, and I've been using a CPAP machine for quite a while. I have to tell you, when I was first diagnosed, very, very apprehensive. My husband had been using one for a while, but I just wasn't too sure if I was ready for it. But I have to say, it has made a huge difference. I did struggle in the beginning. I had some issues with the mask and the way I was sleeping. I persevered. I got used to the mask with the adjustments. And now everything is absolutely fantastic. I get a good night's sleep and I wake up in the morning, I'm refreshed. I don't find that I fall asleep now in the afternoon. I concentrate, and it has made a huge difference on my life. What I can say is, if you do have to use a CPAP, please bear with it. It benefits us so much. You will really see a huge difference in your life. So my suggestion, just keep persevering.
I'm John. I was given a CPAP machine. I was having 40 episodes a night and I wasn't sleeping very well. As a result, I was given one. I had absolutely no trouble whatsoever with using the CPAP machine. The benefits I found from using the CPAP machine is that I now sleep an entire night uninterrupted thanks to this machine. And it's basically changed my life.
When you get the CPAP machine home, it will come in a bag that looks like this. Within the bag, you will have your CPAP machine. You'll have your mains cable, which will plug into the socket, and the other end will plug into the transformer. The transformer will then plug into the back of the CPAP machine. You will have your hose, and you'll have your mask. There is also a filter situated under the side flap of the CPAP machine. The mains cable plugs into the transformer, like so. The transformer plugs into the back of the CPAP machine, like so. Make sure it's pushed in firmly so it makes a connection. The hose then attaches to the back of the CPAP machine using the elbow joint. And the other end of the hose attaches to your mask. So when you first plug the CPAP machine in, the first thing that will come up on the screen is the company name, which is ResMed, followed by a split window, and then another window appears. This window is saying it's preparing a data card. There is a data card in the side of the CPAP machine, and this records your compliance data, how many hours you've used the machine. Because it's constantly recording to that card, if that card comes out, you may get an error message appear on the screen. So make sure that card is always in there. This is the home screen that you eventually get to. At the end of the day, this is the only button you are going to need to press, and it will turn the machine both on and off. When you push the button, the machine will turn on. Within the circle is the current pressure, and at the top right corner is the upper pressure that the machine will get to. To stop the machine blowing, you push the same button and that stops it blowing. This button takes you to the home screen. There are a couple of settings that are open for you to change in My Options. When you turn the dial, whatever you highlight in blue, you can then select. So in My Options, we'll push the dial down to select that. The first option is the ramp time. The machine gives you a period of time where it starts at the lower pressure and will gradually build up to give you a period of time so you're comfortable and you're able to fall asleep before it reaches the higher pressure. There are two ways of setting this. If we select the ramp time, you can set a period of time. Currently I've set it to 20 minutes. So this means when you turn the machine on, it will start at a lower pressure. Over the 20 minutes, it will gradually increase in pressure, hopefully so you don't notice the increase. And by the end of the 20 minutes, it will be at the higher pressure. If, however, you are still awake after the 20 minutes and it's at the higher pressure, it may feel slightly uncomfortable. The other option for setting the ramp setting, if you continue to turn the dial past the timings and set it to auto, the machine will then take over. It will start at the lower pressure and it will stay at the lower pressure until you go to sleep and your apneas occur, at which point it will detect that an apnea has occurred and the pressure will then increase to the upper level we have set it to. We shall select that. The next option is which mask you're using. And the reason we would adjust this is simply because the machine has to compensate for the leak coming from the mask or the air vent. You can also run a mask fit. If you run this, you select it and push the dial, and it will blow air through your hose and your mask and give you a green smiley face if you have a good fit, or an angry red face if you have too much of a leak. As soon as you get a good seal with your mask, obviously after some adjustment, you will go back to having a green smiley face. To stop the mask fit, if you push the dial again, that will stop it blowing. The last function, these machines have their own Wi-Fi. We are going to be set up so we can communicate with your machine remotely. That will give us access to your compliance data as well as your settings. If you are traveling by plane, although it's okay not to use the machine while you are traveling, or you do not want us to connect to your machine, by turning the aeroplane mode on, you can turn the Wi-Fi off, but that will mean that we cannot connect to your CPAP machine. So make sure it is always set to off. Those are the options that are open for you to adjust. Otherwise, your clinical physiologist will have preset those settings for you, and the treatment will be fine to use as soon as you get it home. You push the button and the machine will turn on. At the current settings, your ramp is on auto, so that means the machine will come in at a pressure of 4 and it will stay at the pressure of 4 until you go to sleep, and then it'll go up to a pressure of 8. The screen will go blank during the night, so it's not glaring at you, but it will continue to blow. In the morning when you wake up, you push the same button to stop the machine blowing. Your sleep report is displayed, which tells you how long you've used the machine for and whether or not you've had a good seal with the mask. In order to turn the machine off completely or put it into standby, you hold the on-off button down until the screen goes blank, and that turns the machine off.
This is a standard nasal mask, and it's the most common type of mask that we use. This is because most people prefer to leave their mouth clear so they can take a sip of water in the night or talk. Even though most people with obstructive sleep apnea syndrome say they breathe through their mouth, provided you can breathe through your nose and you don't have any structural obstruction to your nose, such as a polyp or a deviated septum, you should be able to use a nasal mask. A nasal mask is also suitable unless you have very frequent nasal infections and colds which result in a blocked nose, or if you have very severe hay fever, this may not be the right mask for you. I'm going to put it on now, Amna, and you can help guide me if I get this wrong. So I think the easiest way to put it on and off is to unhook the mask. So I'm now going to just unhook the Velcro loop. I'm now going to put it on over my nose.
That's right. If you pull the back of the strap down to the base of your head. Here we are. You'll know it's in the right position because you'll have a strap above and then a strap below your ear. Now you loop it over the hook. Make sure the straps aren't twisted and the mask is in the center of your face. Is that comfortable?
Yes.
Okay, you can now turn the machine on. Is the mask leaking?
There's the air coming through the air vent here.
But nothing blowing into your eyes or leaking underneath your nose. That's a good fit. If you need to wake up and go to the loo during the night or have a sip of water, in order to remove or detach yourself from the machine, if you stop the machine blowing and pinch the grey buttons on both sides of the elbow joint and release yourself from there, and when you come back, if you clip it back in, make sure it's in the right place and creating a seal, and then turn the machine back on to start the treatment.
So now we're going to show you how to put on a full face mask. This is suitable for people that can't breathe purely through their nose because of an obstruction such as polyps or septal deviation, or patients who develop nasal congestion when they're using just a nasal mask. This has two magnets on the side which can be released to put it on.
So again, with the straps, you need one strap above your ear and one below your ear, and make sure the base of the straps is at the base of your head. That's one, and the other side slightly higher up, perfect. Is that comfortable?
It feels a little bit loose at the moment.
Okay. You can tighten it.
Okay.
Is the mask leaking? That's a perfect seal. If you need to wake up and go to the loo during the night or have a sip of water, you can detach yourself from the elbow joint. So if you turn the machine off, pinch the two clips on either side of the elbow joint and release yourself from there. If you have a straw, you could have a sip of water through that opening there. Once you've had your sip of water or come back from the bathroom, you then reattach the elbow joint. Make sure it's secure.
If I want to take it off this way, I can also do this, can't I?
Yes, and lift it over your head.
The least common type of mask we use is called nasal pillows or nasal cushions. Some patients do like it because there's less strappage involved in putting this on. But it's obviously not suitable for people who can't breathe through their nose because the air is being delivered solely into the nose. It can create some soreness around the nostrils, so if that happens, do contact the respiratory physiologists and they'll see about fitting you with an alternative mask. So this one, Amna, I think I start by putting the cushions in my nose first, is that correct?
Yes, and then slipping the straps over the top of your head. The opaque strap goes to the top of the head and the lilac strap at the back. Make sure the pillows are positioned round your nostrils to create a seal at that point.
And if I want to tighten it a little bit, I can do it like so.
Yes.
And this can be tightened up if I need it tightened up.
Yes.
Right?
If you turn the machine on. Is that leaking? Perfect seal. With this mask, if you need to go to the bathroom or have a drink of water, you need to stop the machine blowing and you lift this mask over your head. You don't need to undo the straps.
That's pretty easy, isn't it?
Yes. And when you come back, you slip it back over your head and make sure the pillows are positioned into your nostrils. Opaque strap over the top of the head, further back. And then you return the machine back on.
So we're now going to talk about how you troubleshoot any issues with the CPAP so that you become comfortable with a mask. It is important to realise that it might take some perseverance to get used to sleeping with a mask on your face, and that the comfort will come from habitually using the machine at night. One of the common problems that patients experience is that if they're using a nasal mask, that their nose becomes blocked or congested, or they might find that they're sneezing in the morning or developing a runny nose. This is particularly likely if you've been given a nasal mask, either a standard nasal mask or nasal cushions. The first way to deal with that is to try using a steroid nasal spray. For example, one that you can buy over the counter or one prescribed by your GP. Something like a mometazone nasal spray or a fluticasone nasal spray that is used for hay fever. If that is not effective in relieving your symptoms, the second thing that you can do is phone the respiratory physiology department, explain your symptoms and ask for a humidifier. The humidifier is a circuit that has some water that moistens the air and makes it less likely that the air will irritate your nose and cause sneezing and congestion. If using a steroid nasal spray and a humidifier doesn't solve the problem and you're still having problems with nasal congestion, you can ring the respiratory physiologist to ask about being fitted for a full face mask. And this is a mask that covers your nose and your mouth. What do I do when the mask is leaking, you might ask?
If the mask leaks, you can pull the mask away from your face, allow the air into the cushion and make sure the cushion hasn't buckled. If that does not solve the leak, you can then tighten the straps, or you should wash the mask. Make sure you maintain the mask by washing it weekly using a mild detergent. Avoid anything like hand wash or shower gel to wash the mask.
Another problem that you may encounter is that you're able to fall asleep with the CPAP on, but then you wake up in the night with the similar choking or gasping sensations you had before using the CPAP. Or you wake up in the morning finding that you've pulled the CPAP off and it's by the side of your bed. Or your partner may say you are still snoring when using the CPAP. These are all suggestive of the fact that the CPAP is not set at a high enough pressure. What you then need to do is ring the respiratory physiologists and they will arrange for you to bring the machine in and have the pressure increased. And they may also arrange a separate CPAP titration study where you sleep with one of our variable pressure CPAP machines, and that study will determine what exact pressure your machine should be set on. So don't be disheartened if you are finding that you've pulled the CPAP off, or you're finding that you're still waking up with the CPAP on. This may just be a sign that your pressure needs to be adjusted.
Sometimes when patients put the mask on, it does feel a little bit like their breath is being taken away, and that can make some people panic. In order to overcome this, the machines have a ramp setting. The ramp will start the machine at a lower pressure and give you a period of time before it's built up to the higher pressure, hopefully allowing you to fall off to sleep before you experience that sensation and it feels too powerful.
Some patients, however, actually find a ramp uncomfortable. They want to feel the sensation of the air blowing in and opening up their airway from the beginning of putting the mask on. If you feel the CPAP is uncomfortable initially, it is worth checking on your machine whether the ramp is on or off and altering it as necessary. Guidance can be provided if you phone the respiratory physiologists. So what happens if you are able to use the CPAP machine comfortably? Your respiratory physiologist has told you that the CPAP is set at the right pressure and your mask isn't leaking, but you're still having broken sleep during the night and you're still feeling sleepy during the day. It is possible that you have an additional sleep problem, and what we would like you to do, if you haven't got a clinic appointment in the next few weeks, is to contact the respiratory consultant through the secretary, and they will arrange for you to have an additional sleep study done so that it can be decided whether it might be appropriate to recommend a different type of device with your mask.
So, the CPAP mask is only designed to last for a year. In order to maintain it, to keep it lasting that long and maintaining the seal, you will need to wash the mask with washing up liquid once a week. Avoid using hand wash or shower gel or baby wipes or anything along those lines. There's also a filter in the side of the CPAP machine, and that is to remove any excess dust. That will need to be changed at least 6 monthly. When it looks like it's dirty and it needs washing, please contact us for both the mask and the filter and we can post them out to you. Or if you're coming in to see the consultant, bring your CPAP machine with you and it can be serviced at that point and any replaceable parts can be replaced.
So I'm now going to talk to you about informing the driving authorities about your diagnosis of obstructive sleep apnea syndrome. The clinician that saw you in clinic should tell you whether you need to inform the DVLA. Patients with moderate to severe obstructive sleep apnea syndrome with daytime sleepiness, whether or not it's in front of the wheel, need to inform the DVLA once the diagnosis has been given. Patients with mild obstructive sleep apnea syndrome need to inform the DVLA of their diagnosis if within 3 months of starting treatment they still have symptoms of sleepiness. Lots of patients say that they never feel sleepy in front of the wheel and therefore they don't understand the reason why they need to inform the DVLA. It has been shown from studies that patients with obstructive sleep apnea syndrome do less well on simulated driving tests and they have reduced reaction times. So even if you don't feel you're necessarily at risk when you're behind the wheel, there is a small additional risk until you're treated. And that has to be borne in mind and explains why the DVLA requires you to inform them of the diagnosis. The way to inform the DVLA is to either download an SL1 form from the website or call the DVLA and ask them to post you a form. The information that you need to fill out on that form should all be available from your clinic letter, but essentially it asks for the severity of your sleep apnea and what sort of treatment you're being given. And if you're watching this video, you will have been given CPAP therapy. Once you've completed that information, the DVLA will often write to your clinician and ask whether it's true that you've been provided with treatment and you are undergoing surveillance. The clinician will contact you if they need any further information about how you're getting on with your treatment, but they will then complete the form on your behalf. It is very unlikely that you will have your driving licence revoked unless you are very significantly sleepy, you're not able to have any treatment or you're not responding to treatment, and in particular if you're a professional driver. The vast majority of people retain their licence without any problems. The reason that it is important that you inform the DVLA if you are told that you need to do so is if you have not done so and you were to have an accident, even if it isn't your fault, and the accident is severe enough for your medical records to be revealed, if it shows that you have obstructive sleep apnea syndrome and you haven't informed the DVLA, the insurance company may not provide you cover. So really informing the DVLA is to protect you and your insurance policy. It is of course important that you do not drive when you're sleepy for your own personal safety. So we've now told you a little bit more about obstructive sleep apnea and CPAP. We've shown you how to assemble the machine and fit the mask. We've given you the information you need to troubleshoot any problems so you become comfortable. We've also told you when you need to contact us for us to help you. If you're watching this video in hospital, you will now be fitted with a mask by a respiratory physiologist, and they will use their expertise to choose the right mask for you. After the mask has been fitted, you will have an opportunity as a group to ask questions from the physiologist. If you prefer to ask a question in private, you can stay behind at the end and ask the physiologist then. Before you leave the session today, we will give you some written information. For example, we'll give you the links to this video, so if you wish to watch this video at home when you go home, you can, and you can also show it to your partner. We'll give you some written information about the tips if you prefer to read it rather than hear it on the video. We would also like you to buddy up with at least one person in this session today who's starting CPAP, so you can provide some more informal support for each other and talk through problems. That might just help you get to using the CPAP comfortably sooner than if you didn't have a buddy. It may also be useful for spouses to make buddies to discuss the situation with their partner requiring CPAP. We'll leave that up to you, but support is really important, and of course we're always there to support you. You just need to reach out and contact us on the numbers given. I think the really important thing to remember is that CPAP is a very validated treatment, and there are thousands of people in the UK and across the world that are using it successfully. It can sometimes take a short while for the teething problems to be worked through, but the benefits from CPAP in terms of your daytime functioning, your alertness, your mood, your memory, your concentration far outweigh those small teething problems. We really hope that CPAP is going to be a positive experience for you, and we will do everything we can here at Harefield to make sure that it is. Please do reach out to us if you need any help.